Diagnosis 101 Your Guide to Wellness. Hello, everyone. In today's video, we will be discussing a serious and often misunderstood blood cancer known as acute myeloid leukemia, or AML. The information provided in this video is for educational purposes only and should not be considered as a substitute for professional medical advice, diagnosis, or treatment. I'm here to guide you through the key aspects of this disease, its definition, causes, symptoms, and available treatment options. Acute myeloid leukemia is a type of cancer that affects the bone marrow and blood. It occurs when abnormal cells, specifically myeloid cells, start to multiply uncontrollably, crowding out healthy blood cells and impairing their normal functions. AML is a relatively rare form of leukemia, accounting for approximately 20% of all cases. It can occur at any age, but it is more commonly diagnosed in older adults. Men seem to be slightly more prone to AML than women. However, it's important to note that anyone can develop this condition. Now, let's talk about the potential causes of AML. In most cases, the exact cause is unknown. However, certain risk factors have been identified. These include exposure to high levels of radiation, certain chemical substances such as benzene, prior chemotherapy or radiation therapy for other cancers, certain genetic disorders, and a family history of AML. One of the challenging aspects of AML is that its symptoms can be quite vague and nonspecific. Individuals may experience fatigue, weakness, frequent infections, unexplained weight loss, easy bruising or bleeding, shortness of breath, and even bone pain. However, it's important to remember that these symptoms can be caused by various other conditions as well. If AML is suspected, a series of diagnostic tests will be performed, including blood tests and a bone marrow biopsy. These tests help determine the presence of leukemic cells, their specific characteristics, and the subtype of AML, which is crucial for developing an appropriate treatment plan. Treatment for AML depends on various factors, including the patient's age, overall health, and genetic makeup. The primary goal is to achieve remission, which means the absence of detectable leukemic cells. The main treatment approaches include chemotherapy, targeted therapy, radiation therapy, and stem cell transplantation. Chemotherapy is typically the first-line treatment for most patients. It involves the use of powerful medications to destroy leukemic cells. Targeted therapy, on the other hand, focuses on specific genetic abnormalities present in the leukemia cells. In some cases, radiation therapy may be used to target leukemia cells in specific areas. And for eligible patients, stem cell transplantation can provide a chance for long-term remission. It's important to emphasize that AML is a complex disease, and each patient's treatment plan may vary. Consulting with a hematologist or an oncologist who specializes in leukemia is crucial to ensure the most appropriate and personalized treatment approach. Diagnosis 101 Stay curious, stay informed, and stay healthy.